Welcome, everyone. It's our Wellness Wednesday webinar for our patients. And thank you, everyone, for showing up to our Wellness Smile protocol. And today we have a special speaker, our lead hygienist. She's biological hygienist, also our trainer. We train so many offices in the country and international. And Laura is our trainer for our wellness hygiene protocol. So today I want Laura to share with you what we're doing in the practice in terms of taking care of the gum, the bacteria, the microbiome, because that's a lot of questions related to patient with Alzheimer, with cancer, with autoimmune, and we know that gum disease is autoimmune disease. So we want to make sure that we have the good understanding what's available to take care of you and how you can be a part of this process, starting from home to the practice. So welcome, Laura, take it
Thank
away.
you. All right. Hello, everybody. Thank you for coming in. I'm going to be going over our Wellness Smile protocol. And this is everything that we have to offer, everything that we include in your visit, and just everything that we do step by step so you can kind of see before you come in. So, this is how it's a little bit different. First of all, we treat you not just like a number. You're not going to come in just for, your cleaning, get polished really quickly and then head out. We're going to make sure you're really comfortable first and then make you feel like, you're at home basically. Because we want to get to know you more than just, oh, how many times a day do you brush your teeth and do you floss? Okay, and then keep you moving. We want to get to know like what your goals are, why you're here, what your wellness goal is, and any history that may have got you to this point that you're here today. So it's a little different. So we're going to go into everything that we do that's a little bit different. So we're going to get more than just your general like medical history. Like we want to know more than what supplements are you taking? We want to know about your sleep, your diet, how you're feeling, and overall like what matters to you the most. Because we really want to know in your own words like how you're feeling, where do you want to go, and how we can help you to feel better, basically. So more like the full picture and not just about your teeth and your mouth, and then that's it. So, why everything matters, kind of like Dr. Katie mentioned, was we started saliva testing and looking deeper because we realized the connection, between your systemic health and the mouth. So, if we're digging deeper, we're looking into your airway. That's a big thing right now. And so, airway and breathing is so important. So we're going to talk a little bit more about that in a little bit, but we also know that the bacteria in the mouth can affect like heart and inflammation in the body, and also that nutrition plays a big part in how you're healing and just overall, if you're inflamed, it puts your body not able to heal as faster as it could, like if you're dealing with something
Yeah.
stronger.
I'm glad you bring up the airway and breathing because we have patients that seeing 26 providers this week, and no one have ever asked the patients when the last time you have a sleep test done, how much oxygen you're getting at night. And this patient's taking lots of supplement, working with so many providers, doing so many testing. And the most important thing is the oxygen, nobody tests. And this person, and you're gonna mention about the test that we
Hmm.
talking about, and nobody ever look into if this patient get enough oxygen at night, and that's the time that your brain detox and your body recover. And so the mouth is like a window to the body, is also the start of the gut. And so when we you come into your hygiene visit or your wellness visit, it's not just about getting your teeth clean.
Hmm.
It's about make sure that everything is working and make sure that you don't have anything that you missing on in terms of prevention. We're really big on our prevention because it's so much easier and more affordable than have to provide for treatment.
So, like she mentioned, the mouth is like the gateway to the gut, to the body. And so we want to look deeper. We want to look into also like how the different screenings that we can do for you. So we're going to check several different things, but before we check into those things, we want to make sure you're comfortable. So when you come in, you're going to get a comfort menu, and that's going to offer several different things for you to choose from to make you feel at ease, to make you feel comfortable, welcome, really relaxed. You're not going to feel like a number, and that's really important to us, that you feel important and valued. So a big favorite is like the weighted blanket that you're going to get because that's really good for anxiety. If you're feeling anxious, that helps a lot. You're going to have color therapy glasses. So, depending on how you're feeling, there's a different color that's going to be placed over your eyes during your visit. You're going to have support, whether it be a pillow under your neck or your knees, anything to make you feel more comfortable. That's what we're going to do for you. We also have different choices for you. Like if you're feeling anxious, we're going to talk about it in a little bit, but we have something called an Alpha-Stim. That's new, and so we're going to go over that with you. It's a good tool for anxiety, besides like laughing gas, basically. We also
Because
have,
laughing gas not for everybody, right? Depends
right.
on their genetic pathway, and the laughing gas may not work for them, might not
Yeah.
be healthy for them. So they're drug-free options, and
hmm
Alpha-Stim is one of our favorite.
Yeah, a lot of patients love it. So I think that's really good to try out. This one right here is my favorite. It's called the Sauna Space lamp. It's really soothing and it even puts off like warmth and heat. So a lot of like wellness clinics and a lot of places like IV places and Cairo place, like a bunch of different places are offering red light therapy. And we have one of these in every op. So you're gonna definitely feel more relaxed. You'll feel the warmth and you'll feel it working because it supports your healing on a cellular level. So it's really cool. I'm
Yeah.
really happy that
And it's not
we
an
have those.
LED red light panel because
Mm-mm.
most of the red light out there are LED panel. This light is true pigmented light. And so you actually can look into the light and not see the flickering. And you can actually like your body draw into it. You actually love to be around it. We send one of these light with every patient that has surgery done with us, and they all bring it back and say, "Man, I love sleeping with this.
Mm-hmm.
I love working and have this light on around me." So you definitely should check it out.
So that's my favorite thing. This is kind of how it looks whenever you come in. You're going to have the weighted blanket and the glasses, and it's just going to feel warm and welcoming like a spa. And so this is what we were talking about, the Alpha-Stim. So it kind of just you place these
Microcurrent, yeah.
microcurrents on the earlobes,
Yeah.
and it sends a slow, like soothing pulse, basically, and it helps you feel really calm. A lot of people use these to help them fall asleep or if they're anxious to get on a plane. Like there's so many uses for these. It's just it helps you feel calm and just less aware of everything that's going on, basically.
To me, when I have it
Yeah.
on, I feel like I don't drink alcohol, but I feel like I have a cup of drink and it just relax you without you actually have any alcohol or drug. So this is
hmm
a really good, it's based on the microcurrent and it's on the earlobe. So it's very aligned with what people call it meridians or acupuncture. And everyone that trying it was like, wow, it's powerful. It's actually working.
Yeah. So that is a patient favorite of those. So before we actually start the cleaning, we do a lot of screenings. And so we're going to check different things like your hydration, your pH, nitric oxide, and oxygen levels, like Dr.
Hmm.
Katie mentioned.
Yeah.
So we check the pH to see how acidic your mouth is. Because if your mouth is more acidic, it often leads to like your enamel becoming more soft, more prone to cavities. And it's just really good to know like how acidic the mouth is. And so we can kind of give you recommendations on how to make it more neutral, more
Yeah.
alkaline.
And on this, if you're watching this webinar and you're like, well, how do I get this at home? You can order these PS strip online. And then my recommendation is getting your first urine of the day. So
Mhm.
first morning you wake up and you test your urine to see if you are acidic or not. Because all of the cancer patients are acidic. And if you know you're acidic, why don't you work on that before you have these diagnoses, right? And so the good way to track it, do it for 3 to 5, and the best is 7 days. And then that when you start was like, oh, I need to increase my hydration.
Mhm.
What kind of water do I drink? When do I drink the water? Do I get, smoothie into my diet? Do I getting more of the breath work? So my body less acidic. Am I stressed out too much that causing cortisol level rise up in the afternoon and now I'm getting acidic? So this is a good awareness. And so first urine or first saliva of the morning, we tell patient if they acidic in the chair, and then the patient at 8 o'clock or the patient at 4 o'clock, they may say, "Oh, I drink coffee," right? We know that is can affecting the pH testing in the chair, but the best way to test is the first thing in the morning.
Mm-hmm.
Okay.
Yep, perfect. And we also check for your nitric oxide level.
Mm-hmm.
So that's going to help us determine if you're doing enough nasal breathing, because if you're doing more nasal breathing, you're getting more nitric oxide
Mm-hmm.
to your body. And that's really good to help relax like blood vessels. So that also helps with your blood pressure. And even things like certain things you eat can affect your nitric oxide level. For example, like beets are high in nitric oxide.
Very high.
So
Mm-hmm.
we like to screen to see where you're at and then offer different type of like nutritional recommendations or just tips because a lot of people have never heard of tracking nitric oxide before.
Mm-hmm.
And if they have higher blood pressure, those two things go hand in hand. So it's eye-opening just what one little test can show you. So every time you come in for your cleaning, before we even start, we're testing all these things.
Yeah. I think people start pay attention to nitric oxide during COVID.
Yeah. Mm-hmm.
Yeah, because people like lost the sense of smell. Some people still have that problem.
Mm-hmm.
And it's all coming down to you not having enough nitric oxide. The same with people that have dementia issues, blood flow to the heart, blood flow to the brain or the tissue. You have to know what can increasing the nitric oxide. And this is why we don't want people to use mouthwash. But just any mouthwash, especially like Listerine or the strong mouthwash that you get over the counter, they destroy your microbiome and also reduce the level of nitric oxide that you can generate in your body. And so a lot of these information, people thinking, oh, I'm doing good at home. I'm actually doing more things and keep my mouth clean. But in turn, you actually make it worse. And so these are the education opportunity for us to know where you at and what you can improving and personalize it to you.
Mm-hmm. A new tool that we have been using lately is this hydration checker. And it's really interesting because you place it on your hand or anywhere really, and it gives you a percentage of how hydrated or not hydrated you are. So it's kind of fun to test. Sometimes I have patients guess, like, okay, what do you think you're going to be at today? And they're like, oh, all I've had is 3 coffees and that's it. So it's kind of cool to get a percentage and then you'll remember throughout the day like, oh, I should probably be drinking water because I'm only at 10%. So that's something we like to track because that also helps your mouth too, because if you have dry mouth, that leads to just a
Cavities.
domino effect,
Yeah.
like cavities,
Bacteria
yeah.
overgrow, all of that. And people also thinking hydration is just drinking water. It's actually stretching. So every hour, do you get up and stretch? Do you get up and move around? Do you work on your fascia? Because if you're just chugging water, guess what? Your kidney just working harder and you pee. But if you stretch, now the water can get into the tissues level and stay into the cells longer. So also what kind of water? We ask the questions of what kind of water they drinking. Yeah. Is that filter water? Is that distilled water? Is that reverse osmosis you have in the house? Because people thinking tap water is clean. It's not. And so you have to pay attention to things that you do every single day because accumulate, right? And these are the things that you sometimes forget to pay attention to and see what kind of water you are consuming, cooking, brushing your teeth with, shower with every day.
Yeah, and especially it's kind of a newer like light bulb moment whenever patients that do use a water pick that they've been water picking with tap water and they're like, it's kind of eye-opening.
Yeah.
So, just being able to educate and encourage, why filtered water may be a better option for you, just kind of eye-opening. So we do all these tests just so we can kind of see where you're at and see what we need to do different. So now we're going to go over my favorite part of the cleaning. Before we even do the cleaning, we're going to take a saliva sample and we test it live in office under the microscope that we have in the op. And so we're going to take some saliva and we place it on the microscope and we take a video and we show you exactly what is alive and swimming around on that slide. And so it's pretty eye-opening there too to see what bacteria is present. And so each bacteria goes into a level of risk. Like, is it low risk? Is it moderate or high? Because you do want to have a balance in your body. You don't just
Mhm.
want to walk around just sterile with nothing. So we really teach and educate on the type of bacteria that you personally have. And it's really cool because we can track it because we save this to your chart and then we can try some different recommendations to get the bacteria lower. And then we have some really cool natural treatments to help bring the bacteria down.
Yeah. And when we see a slide on our patients, it's also telling us a lot about the person immune system. If someone having like really high risk pathogens and the activity are so alive and is so fast, that means that their immune system is losing the battle. That means that that person may need extra vitamin C, may need to work on their sleep, may need to make sure that they focus on the nutrition and not just put in a lot of inflammations into the body. And so this is a good screening tool and
Mm-hmm.
reminder that it's not just about killing and balancing out and harmonizing this bacteria, but it's also focusing on our lifestyle and our detoxes. Go hand in hand.
Mm-hmm.
You cannot just eat well, but you also have to detox well.
Yeah, and some patients, they come in and they come in more regularly for cleanings and they may wonder like or you may wonder like why are my gums not getting any better? I brush, I do my cleanings and they're still, inflamed or bleeding, anything like that. When we test for the bacteria, it's like the hidden piece to the puzzle. It's like now I know maybe the products weren't aligned with what I need, or maybe I need extra support here, or some of the bacteria are more resistant to certain things. And so being able to test the bacteria live, that's really my favorite thing because we're able to treat you exactly what you need and not just
Yeah.
guessing.
And people always ask us, where do I get this from? Right?
Yeah.
Especially that slide USC parasite. In the last couple of weeks, I got so many messages and call from people, including, medical and dental providers like Katie, people asking about parasite because of that
Mm-hmm.
lettuce incident. And I'm telling you that we do see parasite on
Mm-hmm.
the slide on the daily basis. And so when people thinking like I wash my hand, I eat clean, well, guess what? You still have parasite and your immune system had to work extra hard. And a lot of the systemic conditions associated with parasite, like heavy metal, autoimmune, brain issues, cancer patient. And so the more you know, the more you can work on it. Unless, unlike the sick care system where they just wait for the symptom.
Mm-hmm.
They just wait until you have diarrhea for like a few days and you're like, oh, you must have parasite problem. We all have that problem. We just need to work on it versus waiting for it to become a bigger problem.
And so this is an example of like how a slide would look. And you can see on this slide, there's a bunch of white blood cells. And so this is really cool to see too, because it means your body is fighting something. It could be anything. It could be, you have a sinus infection or stress, high cortisol levels, anything. But when we see a lot of white blood cells on the slide, it is alerting us like, hey, the body is fighting something. So that allows us to dig a little deeper and ask you, like, how has your sleep been? And not just how many
Or they just
hours.
recover from
Yeah.
something.
Yeah.
Yeah.
Yeah. If they just recovered. So it gives you a lot of information just from a tiny little drop of saliva. We can see all this bacteria. So
Or we
really
can
cool.
also, please come back to the questions that I get a lot. Where do I get this from? Well,
Mm-hmm.
there's three primary sources you can get this from.
Mm-hmm.
Number one, who you exchange saliva with, your spouse, your partner, your children, right? Are you sharing drink and food with someone's? And then what kind of pet do you have at home? Cat, dog, birds. You snuggle and you kiss and you touch and then you pick up your food, all of that contamination. And then on top of it, when we go out to eat, is the utensil and the plate is clean, because what we can see with our naked eye doesn't mean that it's
Yeah.
not there, right? So all of these sources. And so when people actually see this and they're like, okay, I'm gonna go ahead and do this and see if it changed. With the
Mm-hmm.
case where the patient have her cat at home and she was like, I don't think it's my cat. I'm like, okay, let's just wash your hand before you eat anything for the next 30 days. Come back and do another
Mm-hmm.
scan. And it was clean. So now she's like, okay, I guess what healthy for my cat is not healthy for me. That's so true. Same thing, what healthy for us could be lethal to our pets, right? And so you gotta have to find the source, and this screen is like instant. You can see the result right away on
Hmm.
the microscope.
Yeah, so that's my favorite screening tool that we have. And so, since that is a screening tool, it's really visual. We know like certain shapes that we look for,
Hmm.
and we look for activity level of those shapes. Because it's okay to have some bacteria if they're just like there on the slide, just kind of hanging out. But when you see the higher risk bacteria present and they're thriving and spinning around and just feeding, you can see different activity on the slide. And so, that's a really cool screening tool to see. But what we do use is a lab. And what we can do is have you swish and spit into a little tube, and we send that off to the lab. And that gives us the full medical report. So it identifies what we see on the screen that we already know, like what those shapes mean, but it also ties it to more of a systemic connection for you. So we're definitely digging deeper with this test as well because it gives you the name of the species that's present, and we know how to treat that. We know what they respond to and what they don't respond to. So if you have a family history of, you may know someone that has gum disease or, they've lost teeth over time, it's good to know which bacteria they have. That way we can treat them differently because you can't just treat everybody the same. So we really care about, you as a person, and you have to personalize everyone's care.
Yeah.
So using this lab, we're able to get a detailed report, and you get a copy of that report too. So if you're working with other providers, you can take that to them and show them like, oh, could this be, the missing piece of the puzzle that
Hmm.
we've been looking for too?
Yeah. A lot of patients fatigue, and they said that
Hmm.
they run all the tests, hormone, Dutch test, and amino acid panel, like everything. And the missing piece were actually the bacteria in the mouth. And so these are true diagnostic report from a medical lab. We've been working with OraDNA for the past 11 years. They are the gold standard in saliva testing. I'm start seeing a lot of consumer testing available for saliva, and I get all the questions. These companies are reaching out to us and say, can you recommend our test to the patient? My answer always is it a screening tool or is it a diagnostic test? A screening tool may say you have high risk, you have low risk, but the diagnostic test will give us the exact amount of the
Hmm.
pathogen and the name of the pathogen. So we can associate with, is that cancer? Is it autoimmune? Is that Alzheimer? Is that a bone issues, right? Is that a low birth weight, infertility? Like it can connect to all that conditions. And so it's important for you to not only get the test, but also understand what the tests mean and how do we go from here? Because I've seen people do a lot of tests and then they don't take action or they don't know what to do. They have
Hmm.
no quarterback or a provider that can help them guide it. So if you work with a functional provider, a nurse practitioner, or a health coach, anyone that is your medical quarterback, you need to share this result with them. And like us, we are your dental quarterback. So we know before we placing a
Hmm.
ceramic implant on a patient,
Hmm.
we run a test to make sure that their mouth is be able to receive the ceramic implant. Because if they have spirochete and now that spirochete is intervened with their implant integration, guess what? They're going to have implant failure. And so we want to make sure that the body is ready for it. And this is the data that you want to see because it's not just something related to the mouth. It's you swallow your saliva 2 to 3,000 times a day. So if you see that on the slide, you be like, oh, can I not swallow my saliva because there's so many bacteria in there? Well, guess what? It go into your gut, right? And so you got to treat the source and you got to treat what you can see.
This is an example of one of the pages on the report. And this is my favorite page because it shows the link of any bacteria that popped up that we tested for. It shows the systemic link to that specific bacteria. So this is my favorite page to go over with patients because, like Dr. Katie said, we're not just going to give you the report and then be like, okay, go Google, what to do next, or load it into your AI and figure it out. We're going to sit down with you and go over each thing on the report and tell you what this means, what it's linked to, what we can do to help prevent this. Because a lot of these things are, you're more prone to these systemic conditions if you leave the bacteria untreated. So that's the whole purpose of why we test, why we gather all this information so we know where you're at. So we have like a starting point and we can monitor it, through the years and kind of make sure you're in the safer zone instead of like having all these high risk,
Yeah.
bacteria just loose. So,
And the follow-up test, I love it when Laura came to me
mhm.
and say, this patient follow all the instructions and her bacteria reduced 80%. Look at the follow-up report. That's the key. You had to have the report where you know where your baseline, and then you do all this work, right? You take the supplement, you eat, you change the water, you binge brushings and drinking, and now you see the bacteria are reduced 80%. You know the work that
Yeah.
you put in have pay off. And so I noticed that you must have a lot of questions when we're sharing this information. So please put the question in the chat and we will go through all the questions. Either you ask live or we read the questions from the chat. Just make sure you put that in there for us.
Yeah. And so back to this report, initially why we started testing the bacteria was a lot of medical providers were asking us like, hey, we need y'all to figure out like what is going on in their mouth. They have all these things. We need you to test the bacteria. And we started getting a lot of patients with like dementia. And that meant a lot to me because I had my grandma, she had dementia. And just now knowing that we could have, I could have been testing a long time ago on this bacteria and lowering the certain bacteria that's linked to those, certain systemic issues. It's really like life-changing. So that's what I really love to do is learn more about you, like what bacteria is present. You may have a family history of something. And so if we can lower the burden on the body by reducing any of the bacteria, that's really what we're here for. So this is one of my favorite parts of the cleaning is really identifying what bacteria is present, if there's inflammation we can help lower through figuring out your diet, because we have a nutritionist here that can help with figuring out how to lower inflammation. Just like a full body picture. And it's just so different than a regular cleaning. And so,
And we also noticed that you, the one that bring it up, when Laura see patient every 30 days, especially if they are dealing with aggressive dementias or active cancer or autoimmune flare up,
mhm,
we also noticed that the patient that have a lot of existing mercury fillings or infected root canals that's still in the jaw and they haven't got the chance to remove it,
mhm,
their bacteria level are always high, even though they do everything we're asking them to do. So that's really an aha moment for us
mhm,
years ago where we said, oh my God, they've been working really hard at
yeah.
it. They come in every 30 days and we don't see the improvement until those toxicity and infections was removed. And to me, that's also telling you that what in your mouth also contribute to your
Mhm,
systemic, right?
mhm,
So you can do everything right, but you still have an active infection or hidden infection like the cavitations or the root canals. Of course, your bacterial level cannot
mhm,
be lower. And of course, your white blood cell and your immune systems are on fire. And so that really giving us a
mhm,
lot of insight on how to customize the treatment plan to the patients.
mhm. So the actual cleaning is a little different as well. We have a new technology. It's actually more of a spray, like a water pick sensation. And this replaces that sandy, gritty, like polishing paste. You may remember, like at the end of your visit, getting polished with that sandy paste, and you have that stain in your mouth even after you leave. So this is really different. It's a really natural powder, like a erythritol powder mixed with ozonated water for your cleaning. And it gives you a whole different level of clean, like how you feel when you leave. And it's pain-free. It's really nice. It feels kind of like a facial in your mouth almost, but it's really nice. So this is a new technology and no more of that sandy gritty paste.
Yeah.
So,
Actually, this is a personal encounter. I got my teeth cleaned with this technology from Switzerland in 2019. And that's just one encounter from my personal cleaning. I was like, that's it. I need to bring this technology back in the office because in the past, we using this rubber cup and this aggressive and abrasive paste. And greedy paste, and we think that was helping
Mhm.
remove the biofilm. So we would go soco on the teeth and actually not knowing scratching the surface
Mhm.
of the teeth. And if you have restoration, it's scratching your restoration. This technology doesn't even touch your teeth. It's like a touchless car wash. That's how I feel when I get my teeth cleaned. And when we're doing the test, it's actually cleaner. So I'll let you share more about that.
Yeah, so before we even use that, we paint a gel on your teeth. It's a plaque disclosing solution,
From Japan.
basically, from Japan. Yeah. And you can see the picture here. That's how it looks after we rinse off the gel. So that gel clings to any plaque that you have or may have missed, and it also changes color. So it will turn like more purple if that plaque has been there for like 24 hours. So you think, "Oh, I brushed really well," and then you can see the spots you missed, and that's usually where like the bacteria is hiding because it's a hard area to get to in the back, or maybe, you're not able to floss really well in that area. So if you notice on the picture, there's also a turquoise area. That is showing where that plaque sitting there is more acidic. So it's actually eating away faster at the enamel in that spot than it is anywhere else. So it gives you a lot of information, and it just reveals how that plaque is. And if it's been there for like 24, 48 hours and it's acidic, we're able to help you and we're able to show you where that's at.
Yeah, I'm pretty much one every single dental office in the country do this for their patient.
Mhm.
Because if you come in to get your teeth clean and they do all of this spray and this cleaning and you walk out, how do you know your teeth are clean? Well, if they put this on first and identify where your plaque and your biofilm and your bacteria, and then when you walk out, you have nothing on your teeth and it's clean, you know you got clean. Because I've seen patient that got a cleaning at the dentist office last week. And today they in my office for an exam because they have mercury fillings and they have root canals that infected and they want us to look at it. I can look in them out and say, nope, your teeth is not clean. You still have tartar and calculus from long time ago. And so a lot of time we don't feel with our tongue. We got to see with our eyes. We got to see where the biofilms are. And like Laura said, this patient developing decay or
Mhm.
cavities at the gum line. That's where the acid is sitting.
Mhm.
And so we got to know, and like I said, seeing is believing, the slide, the plaque ID with 3 color. That's why they call tri-plaque ID gel. And there's no gel like this anywhere. We had to import it from Japan, and we see the difference when we're using it
Mhm.
and not using it.
And it really helps too for the kiddos too. They're like, I brushed, and we all know that they do their 10-second brush and call it a day. But when you do this, they can actually see and they're like, oh, okay, I need to do a little bit better. But something else about that technology is it's really good for implants too. Those can be hard to clean around, especially if you forget to water pick, or you're on vacation or anything. But those are really safe to clean around your implant, and it gets it make sure it's really healthy. So it reduces inflammation because we're reducing all the biofilm around that. So I really love that technology because it's so easily we can use it
We
so
call it
easily.
guided biofilm
Hmm.
therapy because you basically identify where the biofilm is and then you go and clean after it gently without
Hmm.
disrupting the soft tissue, which is the gum or the implant or any of the tooth structure.
Hmm.
Yeah.
It's really good for crowns too because we're not scratching the crowns anymore. So it's really safe for all your treatment. So
I don't
it's
think
good.
hygienists one day experience that they can go back.
No, I'm like, please don't take this away. No, so it's really comfortable too. So back to the bacteria, depending on what we find on the slide, we offer different things for your cleaning. So we have ozone gas available, and it's really pain-free. You don't really feel anything. It's a gas. And we take that ozone and we go all along the gum line. And so after we clean your teeth, they're all nice and clean. Now we go in with the ozone. That's reducing all the bacteria that's left behind that we can get to now that everything is clean. So it kind of like resets you. And then we go in with a red light therapy for your gums. And red light therapy is really good for inflammation. And so you leave feeling really good because you know you're clean. You know, we've used the solution to show you where the problem areas are. We got everything nice and clean. We did the ozone, which is reducing the bacteria, and then we did the red light therapy all on the gums. So that's good for inflammation. So you have a nice reset to go home with, and then we're going to talk about another day, but all the products that we use to support you more naturally at home so you can do that and keep the
But yeah, it
bacteria.
had to be another day
Yeah.
because otherwise we'd be here until tomorrow morning. But what I like is we showing you a slide after the treatment is done. Because I know a lot of patients was like, oh, I get deep cleaning, I get cleaning out all the time. I don't know, my gums still inflamed. Well, guess what? It's a partnership. So that means if we doing all the disinfections here at the office, your job is going home and be able to maintaining it, right? Either that home care, either that supplement, probiotic, nutrition, hydration, sleep. That is your partnership. That is your job. And we want to make sure you be able to maintaining that. So before you leave the office, our hygienist team actually take another slide and then compare to an hour before. We took the slide before we start this procedure and now the slide after, and we said, look at how your mouth is so much cleaner. There's no more bacteria. It's like swimming like crazy. Let's go home and protect this and maintaining this for the next 30 days. And then we bring you back and check on it. And if you can maintaining it, you're good to go for the next 90 days. Because again, you swallowing your saliva every 30 seconds. I know once people see what's in their mouth, they're like, I don't want to swallow my saliva. I don't want to kiss my husband's or, my kid. But definitely you got to see the work that working for you here because I always say it's 80-20. 80% of success are counting on you. 20% of success, we're doing all this therapy here in the office, and then you'll be able to have to maintaining that and be able to protecting that with your immune system. And so you will be able to see the work. So you know, hey, this is done in the office. Can I maintaining that? Can I have the motivation to work on my sleep, my nutrition, my stress level? So my immune system is not on fire.
So that is your cleaning in a nutshell, basically. And so what that means is we care more about you. So we're gonna dig a little bit deeper. You're gonna feel more at ease, more calm. We're gonna try to help you achieve your wellness goal together. And so we're gonna do our part and help you to do your part, and you're gonna have your more personalized home care routine too. So that helps too. So it all like comes together in the end after all the screening, the digging deeper. We care about you as your whole body. And so you're not just like a mouth that we're just gonna, okay, you're a number, let's come in, do your cleaning, see you in 6 months. So we really offer personalized care and care about your whole body.
And everyone, I would say, have a different appointment interval. So, for example, we have active cancer patients or flare-up autoimmune patients or aggressive dementia, Alzheimer patients. Those patients medically have to be seen every 30 days to make sure that there's nothing is too accumulate and too severe that knock down the immune system and really make them get worse. But I have patients in our practice, they come see us once a year. They do a great job at home. They have a very solid nutrition, hydration, sleep, restorative breath work and all this thing at home, and they be able to maintain that. And also based on genetics, some people have super gene, some people don't. Some of us are lucky and some of us not so much. And so these are something that it had to be personalized to you. It cannot be like everybody on 6 months. Well, guess what? That 6 months is insurance propaganda, or it's a commercial from a toothpaste in the 1920s. So we cannot just put everyone under the same bucket. We cannot just treat everyone like Laura said, like a number, because that's exactly what happened to our healthcare system, aka sick care, right? Most of the people, by the time they have bone loss, they come to us, it's like, my dentist said I have bone loss. We can't get the bone back that quickly, right? There's a lot more issues we have to address. However, that bone loss is already done. And so that sick care is already creates so much damage versus look at the root cause, look at the personalizations and home care. And we tell patients, just be honest with us. What can you do? Don't say yes to everything and not do anything. It's a partnership. You think we're not going to find out in 30 days that you're not doing any of this, right? So if you be like, okay, Laura, I can only doing electric toothbrush right now.
Hmm.
I will floss maybe once a week. Okay, let's get a water pick. Maybe that's easier for you than flossing, right? And so I've seen a lot of commercial on products like the floss pick or the floss vibration thing. Well, guess what? Floss is like toilet paper. You do not use the same square. I promise. Nobody in here go to the restroom and use one square over and over. And so when you floss, treat that floss is like just like how Laura taking a sample and put under microscope. You cannot reuse the same piece of floss for the whole mouth. When we floss, we take actually a foot long of floss, wrap one end and wrap the clean end on the other. And as we go, we keep going. So that way, when you floss, each area is a clean piece of floss. So always think treating the floss like toilet paper. You do not reuse it, and you don't want to spread the bacteria around because some bacteria in, say, the wisdom teeth area, now you spread it all the way across, and now you just like share everything in the whole mouth. And so those information are something that we want to show you and teach you so you can have that life skill to teach your kid, to teach your friend, to share with your family, because wellness is starting with you and it's an everyday thing. It's not something that you do when you go to the dentist and you go home, you don't do it anymore, and you come back and do it 6 months later. It's not how wellness is supposed to be.
So the next thing we'll do is open up the chat and any questions that you have, and we can go over all of that right now.
Yes. Okay. All right. So our job and our purpose for this webinar is educating. The more information you know, the better question you ask. And obviously, the better choice you make. The educated patient is the empowered patient. And we always tell patients that if you understand something, you don't have to memorize it.
Yes.
It makes sense. One of the guests on my podcast, Dr. Jess, she said common sense is fast and science slow. And we see that, right? Common sense, just like the piece of floss that we're talking about, is common sense. Do you want someone to do a research on it? Guess what? Who's gonna pay for that research? Who's gonna benefit from that research? That's reality of research on science these days. So just follow common sense. And the best thing is just go ahead and try it, test it out, and see if it's working for you. All right, I'm gonna go ahead and stop sharing so we can answer some questions here. Perfect. Am I stop sharing already? I want to find the Zoom. Good. Yes, I think we stopped sharing already. Good. So I'm going to go ahead and answer some questions. Good. The first question from Mary, she asked, I have heard about mouth tape while one sleep to discourage mouth breathing. You know what? Laura is also a myofunctional therapist. So Mary, I'm going to let Laura answer that question before I'm chime in.
Yes, and so mouth tape, a lot of people are hearing about it now. And so yes, it's really getting more popular, and it does help you breathe better through your nose. But before you just like jump into mouth taping, you want to make sure that you can pass the test of where you can breathe through your nose for like a good 2 minutes without feeling like you're out of breath and you need to open your mouth to breathe and try to catch your breath. So it's really important to know first if you can breathe, successfully through your nose before you just slap on the mouth tape. But it does, if you are able to breathe through your nose, you will feel a lot better and you'll feel a lot different in the morning,
Yeah.
after you do that.
For every visit, we always check your breathing, which is nasal patency. We blocking one nostril, make sure your lip closed, and we make sure you can breathe through one nostril, and then check the other nostril. And everyone notice one nostril always work better than the other. And sometimes it's alternate, or sometimes patients tell me like my whole life I can breathe well to one nostril. So that awareness will help you to say, hey, do I need to go to see an ENT to figure out why that issues? Because you have two nostrils for a reason. Why you only can breathe through one? More oxygen is better, lower inflammations, better for your brain and your health. And so those are awareness that we don't really communicate with our body. So every morning I wake up, I'm always testing my nostril to see how do I feel today. And then midday, I check it again. Do I have any congestion? Sometimes I walk into the room and that building or that room have mold, my nostril completely closed, right? And so my husband was like, "You're so sensitive. It's protecting me." It's also my genetics, so accept it. But yes, overall, mouth taping is good, especially bad breath. If people have bad breath in the morning, mouth taping, okay? And also the type of tape is important.
Yeah.
Because people do not use duct tape. Okay. If you want to do a TikTok, yes, do it, but not for your health and wellness purposes. It has to be medical paper tape, or there's a lot of mouth tape out there. I'm super practical. If you listen to this webinar long enough, you know I want something that work and not cost a tons of money. So the paper medical tape called the microspore tape you can get on Amazon. The 1 year supply is like $10. A month supply is 99 cents. That's how much we spend on mouth taping. Why? Because we throw away the tape every morning. We can reuse the tape. So you end up with spend a lot of money if you spend $2 a tape. That's $60 a month. To some of you, that's worth it. Great, because some of you have sensitive skin. But again, you gotta have to try it out, and consistency beat the type of tape you use. If you use it once in a while, it's not gonna work. You have to use it every night. We still tape every night, and our children tape every night. And so again, is number one reason people have cavity these days is mouth breathing. Number one reason people have bad breath, mouth breathing. Okay, so working on that. So I love that question, Mary. So thank you so much. And you asked a myofunctional therapist on that. All right. Debbie have a question. Where do I get this OraDNA test? From your dentist. So your wellness dentist should offer this test because they have to do the test, the sample collection. They send it in for the medical lab, and then they got the report back. Any test that you do it on your own, which is direct consumer test, either a screening tool or not a diagnostic test. You're not going to see the name of the pathogen. You're not going to see the level of the pathogen. And when you send that kind of screening report to your functional doctor, they're like, what do I do with this? But if you send a diagnostic test, which is the OraDNA test, they know exactly what to treat you. Sometimes they may have to use some medicine because it's so high and you have symptom. But again, knowing exactly what we're dealing with will really cut down the guessing. Does red light and blue light help the mouth? Absolutely. Also, knowing what light you have is important because there's so many light and the price range are like $40 to like $4,000, right? So you got to know what medical light versus the cosmetic light. Yeah. Usually blue light is for antimicrobial, red light is for healing. And some light combine both and you get some pain relief with those light. Does oregano oil and black cumin seed oil help gum health? Absolutely.
We love oregano products.
Yes. Oregano oil, we actually don't prescribe antibiotic to our patient, and we recommend oregano tablet and also silver. We love Argentine 23. That's what I personally use, copper, silver from Argentine 23 for the last 10 years. Esther asking, what brand or model of microscope do you recommend? You must be a medical. I recognize your name, Esther. Congratulations on your pediatric wellness practice in Georgia. Yes, the microscope we use is from Zeiss, which is a really number one microscope in the world. All the microbiologists and I would say medical laboratory using that brand. So I can send you that information. Just DM me. I'll send you the link for that microscope. Where is the machine for the cleaning? It's from Switzerland. Yes, it's the dental company called EMS Dental, and they a Switzerland company. They also the theme color is pink, so we love them too.
Yeah.
But truly, I could not find any machine that clean gently and effective the way they do. And believe it or not, they're very expensive, but it's worth every penny to have that for our patient. Because you know why? We get our cleaning done every 3 months. So we would not want to use anything but that on us. And that's the reason why we have it in our office. Debbie also asked how to fix bleeding gum and deep pocket. It's more than just the mouth, I'm sure.
Yeah, you have to find the source of inflammation first. So, screening for all these things, especially like diet, stress, your sleep, because that's when your body is repairing itself. All of that impacts your gum tissues and the health. So definitely finding out like what bacteria is there helps.
I want to know blood work.
Mhm.
She want to know
Yeah.
bacteria. Yeah, because we know what you fighting and we want to know what your blood work's showing. To a lot of patients, the bleeding gum can be solved by adding more vitamin C, antioxidant. For the deep pocket, is that a pseudo pocket, which is that a false? Is your gum swelling and the pocket deep, or you actually have bone loss? Because if you actually have bone loss, we also want to make sure you don't have deficiency of vitamin D, which is
Mhm.
a pandemic, to be honest. Like I rarely see patients that have vitamin D above 60, which is the optimal level. Most people said, oh, my doctor said my vitamin D is normal. Guess what normal is? 30. And so when you talk about bleeding gums and deep pocket, like Laura want to know bacteria, Laura want to
Mhm.
know, bone level. I want to know blood work and vitamin D level because that's what is telling us how's your entire body, not just your gum, but also your bone. And so you want to make sure that you look at this as a whole body approach and not just like, oh, treating bleeding gum and rinsing with mouthwash and going to the
Mhm.
dentist just to get deep cleaning. Like no one ever get deep cleaning and not understand what else going on in their body. When you have bleeding gum, it's like when you have bleeding anywhere, you would figure it out what's wrong with me, like bleeding ulcer, right? You would go to your
Mhm.
doctor, emergency room sometime because you lost so much blood. But bleeding gum, people are like, oh, it's normal. I
Yeah.
just swallow that or spit it out. You really want to find out what the root cause of that is.
And she mentioned deep cleaning, so that, makes me think of when we do a cleaning like that, that same visit, you're getting the ozone therapy and the red light therapy right after that deeper cleaning. So you're already leaving with your body in a more of a healing state instead of just, they removed all the buildup and send you home with like a rinse. And so it's really important to encourage the healing for your body as well and not just do that cleaning.
Yes. And I see a lot of questions about looking for a wellness dentist that doing this kind of, and the good news is we do and train a lot of dentists and we completing a directory of people that having the machine, the technology,
Mhm.
the testing. And so you can find the provider near you. So stay tuned. If you're in our email list and our texting system, we will share that directory with you very quickly so you can locate the provider that you work with. We are located right outside Houston.
Mhm.
And so we're seeing a lot of patients coming in. But again, we want you to work with someone that you have a consistent, especially with wellness, perio, and hygiene. You want to have that consistency follow up. And so, yes, we want to make sure you connect with the provider that can help you with that. And a lot of dentists actually I actually train quite a bit of specialists, like periodontists, who said, I see patients for bone loss and we do surgery. We do all this thing and they're not getting better. What do you do that help your patients getting better? So dentists also asking question now that they know there's a lot more that they need to know and connect the dot because surgery or the typical procedure that they're doing is not working for their patient. And so one, the patient's leaving, or two, they feel that they do the same thing and the patients start questioning their competency. Is this doctor know what they're doing? Because I do everything he or she recommended. I'm still have bone loss. I still have gum recession. So I do believe that the dental professionals are also more
Mhm.
open to learn about blood work, to learn about saliva testing. I have not seen any pushback when I'm go lecture in national conference about saliva testing and blood work. They want to know more and they want to help patients. Perfect. Does Laura do myofunctional therapy before frenectomy surgery?
Yes, 100%. Yes, yes. It's
Absolutely
a
a
must.
requirement.
Yes.
Yeah. Yeah.
Don't recommend doing any type of frenectomy surgeries without establishing that muscle first with the tongue. So 100%, yes.
Yeah. You will not get an appointment with me to do laser frenectomy surgery if you don't have a letter from your myofunctional therapist. It doesn't have to be Laura. We work with so many myofunctional therapists. If they don't have a letter, and it doesn't matter how old you are. Of course, I don't see infant. We have amazing
Mhm.
doctor here in Houston that doing infant release. But for me, if it's an adult or child that doing myofunctional therapy, I need to get the letter from the myofunctional therapist that what kind of exercise they've been doing, what kind of range of motion. And guess what? You have a test on that day that we're doing release. We want to see your range of motion. We want to see your ability to hold your tongue up in a K position, because the release itself, a lot of people just like the moment we say you have tongue tie, they're like, can I cut it right now? I'm like, no, you have decades and years of muscle memory of how your tongue is down here and not up in the roof of your mouth. So you cannot just cut any tie or release or revision, whatever the word they use out there, right? But basically, you cannot go in there and just expecting that your tongue will know where to go after. Also, during the release, we do some body work, some stretching. And yesterday, we did the release on a patient, and she have a huge release internally in the neck. Like we had to let her really sit there and get used to that new positions of now the tongue, like the release been doing with the laser, and she can feel all the tension from her next release, like from off her shoulder. And so if you don't do the work before, I promise you, you won't get that result during the release. And then guess what? She have to do the exercise immediately after.
Yeah.
Yes. So
It's not
before,
just done. Yeah.
during, and then after. And the after to me actually harder because you just had the surgery. And so most people kind of like, oh, I'm in pain. I don't want to do it. Well, guess what? You have to take some arnica. You have to do some of like we have the Synapse Dental, like the device that helping with pain, and you have to go in there and stretch. And so whenever you hear tongue tie, it's not simple. It's just go in and release. You have to do the work before, during, and after. But my personal experience is worth it because my problem is neck pain, shoulder pain, and wrist pain. As a dentist, everyone says, oh, that's what you have. They all recommend surgery. They want carpal tunnel surgery on the wrist, right wrist, shoulder surgery, and then the neck surgery. And I start with physical therapy and then myofunctional therapy. And guess what? It's been 8 years. I had no surgery, no pain. And so if you treat the root cause, you will get the result, and it's long lasting. And you're not going to touch a lot of surgery because of that. So I highly recommend everyone should work with a myofunctional therapist when you're ready to do the therapy, because this requires a daily exercise.
And it takes commitment too. Like you have to be ready to commit to the exercises. It's kind of like working out in the gym. Like if you only go once a month, it doesn't help as much as if you were to do it daily.
Yeah, agree. And then Debbie asked, are deep cleanings necessary?
Well, we have to see first, like where you're at, the bone levels. We have to look on the x-rays and see like what's underneath, the gum line, see if there's buildup under there. So it's personalized. We just have to see each patient.
Debbie, I think you may not like my answer, but I'm going to tell you the truth. Okay. Most of dentists are underdiagnosed proper deep cleaning. If you want to use deep cleaning as a perio scaling roof planning we talk about. Now, there's a difference between the proper diagnosis and the proper treatment. I apologize. A lot of dental offices may not have the proper deep cleaning procedure. They don't use ozone, they don't use laser, they don't talk about nutrition, they don't look at blood work, they don't look at saliva as tests. That's on them. But most of the American population was underdiagnosed for deep cleaning. That's the reason why we have such a pandemic of bone loss. And now it cannot reverse. Once you have the bone loss, you cannot go in and say, can you build my bone back? It's not possible. And in some cases, depends on your gum type. You can have thin gum, thick gum, or normal gum. The patient have thin gum, guess what you have? Recessions and now bone loss, and that showing the black space between your teeth. And so at that time, a lot of these patients in the young age, like 30, early 40, and they said, I don't like the way my teeth look. Guess what? Your bone already gone. And if we treat it early and we know about these personalizations, then this less likely not happening. So a lot of patients would like to hear that they just need prophylaxis or like the polishing. Well, in reality, if you need the deep cleaning and you got the proper treatment, you actually save yourself from bone loss, from systemic condition. And so right now, based on what we see in our practice, most of patients did not get the deep cleaning that they deserve. So is it necessary? Absolutely. Is it done correctly in our office? No. So that's my honest answer for you there, Debbie. Can you fix someone with severe bad breath?
Yeah,
Hmm.
something that we look at is your sinus health to start with, because if you're having constant
Like
drainage,
post-nasal drip in the
post-nasal
morning.
drip, we'll start you on like a sinus rinse. And so really cleaning out that pathway is a good place to start
From
with
the
you. Anything
top,
else? Mm-hmm.
and then the next is the mouth. Like one of attendees said, do a myofunctional evaluation before
Mm-hmm.
we decide you should tape or not. But again, like I said, if you have bad breath, you definitely have mouth breathing when you're
Mm-hmm.
sleeping or even daytime. Like when you sit in our chair, guess what? Laura looking at you to see if your lip closed. Do you have a good lip posture? Or you sitting there watching TV and your mouth's open? Right? Because a lot of us sometimes don't even not aware of we breathing through our mouth, because we've been doing that all our life. And so fixing severe bad breath, absolutely.
Mm-hmm.
Again, it's 80-20 rule. Are you willing to commit the 80% of the work that you're going to do at home? Are you going to
Mm-hmm.
use water pick, tongue
Tongue
scraping,
scraper.
oil pulling, all the thing that you have to do? And also, are you willing to treat your gut? Because a lot of this bad breath coming from the gut
Mm-hmm.
issues. And so this is something that if you're willing to do it, is you're going to get result. And the result is not just from no more bad breath, it's also better health and gut health and better mouth, oral health, and less cavity and less bad bacteria.
Mm-hmm.
So it's a win-win all around. So I have a patient that we treat severe bad breath, and he was like, I did everything. And you guys help me. You guys should have a billboard that specializes in bad breath. And I'm like, you know what? This is why wellness is so tricky. Because if we can promise the result and knowing that the patient going to do it, I guarantee you, no matter how much it is, patient will pay. The tricky part is that 80%. People want to get the result, but this is why the sick care system are so successful, because they're just going to give you a pill. Hey, 3 times a day, taking this metformin, right? And it's easier than say, hey, you have to now journal your food and change the way you eat and drink.
Mm-hmm.
And that's how you get rid of diabetes. We're going to say the same thing. You can get rid of bad breath. But from now on, you have to do all these things. And most of patients not willing to commit.
Mm-hmm.
And like Laura said, we're not having judgment. And guess what? If we do, we're going to bring all that home and we're going to get sick. So we truly mean it when we say we're not judging patient, because we don't want to bring that resentment home. And so if you can commit to say just the water pick, just the electric toothbrush, we take that.
Mm-hmm.
But we know we're going to have to see you more often.
Yeah.
But if you do more, guess what? We see you in a year. I have patients that flying in from Florida or Seattle or California. We see them once a year and their slide look amazing. And so, yes, you don't have to see dentists every 6 months, but are you doing what you're supposed to do? That's an honest answer that you answer yourself. Okay. Awesome. I'm excited for you. Whoever work with airway dentists, they focus on airway, but they also, you want to make sure that they focus on the microbiome, the
Mm-hmm.
bacteria, because once you get a better airway, you have more oxygens, right? Wider sinus and wider arch. Like I explained to a patient today, airway is like a box. You have 3 dimensions on a box. So when someone having a sleep test that diagnosed with sleep apnea or even upper airway resistant, we explain to them that they can increase the vertical of the box, right? Either wearing an appliance where it helping you making room and do myofunctional therapy, night
Mm-hmm.
lace for the soft palate. All of that will increasing space in between the arch. Or we can do expansion, right? Chew expansions like a Marby expansions, or in children, a palatal expansion. So you increase the width. Now there's way to increase the front and back of the box, and that's usually surgery or a mandibular advancement device. So airway actually really break it down to simple which way you're increasing the
Mm-hmm.
box. And also, are you breathing through your nose?
Mm-hmm.
Like if you increase the box and you still breathe through your mouth, you're not going to get the full benefit of it. So it sounds like complicated, but it's personalized, and it's actually coming down to what treatment is right for you at this season of your life. I have patients that I'm just going to go ahead and do appliance right now. And then 3 years later, she said, you know what? I'm done with this. I want to go ahead and expand my jaw and do this properly. And so we're here to guide you and support you. And whatever you decide to do, it's going to be right for you in this season of life. Okay? Awesome. That's a lot of questions. What can be done if the surgery, I assume frenectomy surgery or
Mm-hmm.
tongue tie surgery, was done without the pre during, and the post work being done. We've
Well,
seen that a lot.
yeah, we do see that quite a
Yeah.
bit because a lot of people don't know that it really, how much it helps you to do the exercises before and after. But I would start with scheduling, a consult to see where you're at. And it's never too late to start on those exercises because you're building that muscle. You're retraining the tongue and the facial muscles to prevent other compensations as well. So it's never too late to start on the exercises. So just getting a consult and seeing where you're at and coming up with a plan.
Yeah. And knowing that working with a myofunctional therapist, it's just one piece of the puzzle. We
Hmm.
always tell patients that you're going to need a body worker,
Hmm.
either that a chiropractor that train in this topic and aware of this, and also sacral
Hmm.
therapist. And so don't be just like, I have to work with this person.
Yeah.
You may end up needing a team. So whenever you come in to see us, we're like, who on your team? How we can communicate with them? How can we send the report to them? How can we ask them to support you if you're going to get the
Hmm.
mercury removal, if you're going to get the tongue tie release? What do they need to do? How we work with them? And so if you work with providers and they don't talk to other providers, to me, that's a red flag because they have to share the findings and the information. And we're very blessed that everyone we work at, even though this is the first patients that we have
Hmm.
mutual with them, they always very open and say, send me that saliva testing. Oh, yes, I do have the blood work on the patient. Let me share that with you. So the more we collaborate, the more the patient benefit from that mutual knowledge and also saving a lot of time to go around and around doing so many tests and so many things. And so, yes, make sure you are asking your provider to talk to each other. And to be honest, in our circle, Houston is a big city, but in this airway or wellness space, everyone have each other's cell phone number. Everyone sharing patients and knowing what are we doing and what are we teaching. And so if you find a community or a group like that, you are in good hands. Yes. Yeah, we see patients that have the release and we see scar tissues and we know that there's limitation, but like Laura said, you can still do exercise. You
Hmm.
can still work on that. Okay, perfect. Yes, we will share the directory with you guys very soon. We're working on this list and we do screen every single provider to make sure that they have the training, they have the technology, the testing that we're talking about. So stay tuned. And next week is the brand new series. It's August. And I'm basically go through my direct message, which is DM on Instagram or messages you guys send me directly from here. And next week, I'm gonna go all in on cavitation. There's so many questions, there's so many information out there, and I know a lot of patients are very confused about cavitation. Do I have it? How do I check for it? Do I need this CBCT or this test or not? So next week, I'm going to share with you a few cases that we have and also what are our protocol and what we're teaching about cavitations right now. So tune in next week, next Wednesday at 6 Central, and please share this webinar with your friends, your provider. We have a lot of provider obviously on this webinar today, and we love that because we're here to not only serve our patient, but also serving our fellow professional and sharing the knowledge with all of you. So we see you guys next week and have a good night.
Bye.
Bye.